So what are EVs in orthopedic medicine? A lot of people nowadays in 2024 know EVs as electric vehicles, but today we're talking about EVs in orthopedic medicine. I'm Dr. John Tait, non-surgical orthopedic doc, regenerative medicine specialist, and let's talk EVs today. So EVs stand for extracellular vesicles. And to not get too nerdy about this today, we're going to keep it really high level. If we look inside a cell, say a stem cell, we have these little packets of growth factors with little blueprints that when these are ejected out of cells, they teach the cells in that environment that need repair how to repair. So your body has this really cool, innately built, hardwired mechanism to self-repair. And so the default of your body is to regenerate. Now, as people age, they feel that the default mechanism of their body is to degenerate because they start to get aches and pains everywhere and feel like they're falling apart sometimes. But when we look at how the body works, it actually pushes stem cells out into circulation to go look for areas of damage. Our body is cluing it in by a little homing signal chemically to attract cells to this area where it needs help, by which those stem cells then release those beautiful EVs into the environment and they stimulate healing. So if we look at where this came from, it was back in 2013. There was a group, a couple of docs that they won a Nobel Prize around this discovery because prior to 2013, we thought this stem cell over here can maybe go to this tissue that's struggling and replicate a cell there that heals that cell to then reconstruct the tissue. So kind of a one-to-one mechanism. And with that discovery, what they figured out is that the machinery kind of regulating all this cellular traffic is what they called it, I think. These were kind of orchestrator cells in a way, and they could stimulate a one-to-many effect. So now one stem cell could impact a multitude of cells in the tissue, potentially, and stimulate much more healing. So when we looked at that, they said, oh, this is a really interesting concept for a couple of reasons. Because we can take stem cells out of a patient, we call that autologous stem cells. So if we take a bone, long bone of the body, or the pelvic bone is where I most commonly extract these. But if we take the bone marrow out, what we call a bone marrow aspirate, and we separate the types of cells in there, we'll get a certain amount of stem cells. The issue with stem cells is as we age, they age. And as we age, we deplete our stem cells. And it's actually a term for one of the many mechanisms of aging, which is called stem cell exhaustion. So if we deplete out these stem cells, they can replicate a certain amount of times, but when they can't do it anymore and the stem cell dies, once we deplete all those stem cells, we don't have the ability to self-repair and regenerate. So effectively, we die at that point. That's the end of life scenario. So when they started to look at these cells, the advantage of these cells would be twofold. One, somebody doesn't have to go through an invasive procedure to extract stem cells, okay? Two, they're from a younger source. So these are sourced from, if we look at now, present day, where are people getting stem cells not from the patient? These are from birth tissues. So if there's a live delivery in your town today and the baby comes out and goes to the happy parents, happy baby, happy parents, then the tissue over here sometimes is saved by that family, meaning they may bank the umbilical cord. If they don't, all those tissues typically go to the trash. And in those tissues are millions of stem cells that brought that baby into existence. So if we think about it, what is medical waste or trash has all these stem cells. And if we could leverage those stem cells to help people and heal tissue, then they started to look at, could we use those and inject them into other people? Because at that point, they don't have these tags. We call them MHC tags, but these cells aren't tagged. So if we didn't have the same blood type, I couldn't have blood transfused into me. There'd be a massive reaction. But these cells at that age are called immune privileged and they're not tagged. What that means is they were safe, they thought, to put in other patients. So they did this. After, of course, doing animal models and seeing that there was checked the boxes there. But if they put these cells in other patients, they could stimulate a pretty robust healing with a potentially stronger treatment because these cells were younger. And so this has just evolved over the last decade, and there's many companies, biotechs looking at the application of birth tissue-derived cells and growth factors, and that's what we refer to now as extracellular vesicles or exosomes, which is a very small version of that. And again, the advantage of that maybe for the older patient watching this is that may be able to get your body bumped with a little bit bigger kick than your own cells that are aging out, maybe not energetically as strong as they once were. The only caveat to this is what's going on in the space around FDA regulations with using these type of things, and do people conform to all the rules around those tissues to be able to use these both in a investigational model to treat various injuries. So we're part of some programs that are working on kind of investigational new drug or device pathways by which we're using these things potentially for applications, say like knee arthritis, which is one of the most debilitating conditions in the world. And we don't have great treatments for this other than palliating it with meds or steroids and then eventually doing replacements. But if you think about it, if we could take these cells and stem cells, whether they're from you or maybe in the future we're able to harness all those cells that are otherwise going to waste and using them for good, then we can stimulate some healing and repair and kind of slow down this degenerative process in the knee, which plagues so many people with arthritis, and they just don't have great options, or they're fearful of the bigger surgical options. So if I got to snap my fingers and control healthcare, which I don't, um, we would use these cells because I read a paper years ago that said if we took a single set of birth tissue, and this stat's going to blow your lid off, but if we took a single set of birth tissue, took it to a lab, extracted all the stem cells from it, replicated those cells, okay, which is another thing that they don't really allow us to do in the US. Because if I had it my way, we would take your cells once or we'd take these other cells, either way, take them to a lab, replicate them, create a bank for you. So you literally have a bank, a fund of cells that you can use over your lifetime to repair your body, which would be pretty amazing. But I digress. Back to the situation with the birth tissue derived cells is that if we did that with a single set of tissue, there's a paper published years ago that said you could create 100,000 doses of treatment from a single set of birth tissue that's otherwise going to be wasted today in medical waste. So it's just an example of where we have such massive potential in healthcare to change a very debilitating condition for millions of people. And we're just not there at this point to really harness that. But I think the future is near. And I hope that it's not too far out on the horizon because we've seen kind of in the past few years that things can move very rapidly when they need to with new development of these, we'll say drugs or molecules or things to help conditions. And man, there's so many people that could be helped by these things. So hey, I wanted to give you a little insight on where this stuff is, and this is so you'd be more knowledgeable about it. Or hey, write your local Congress people if you say, hey, this is something that kind of burns me up, and I wish these treatments were more available. Because unless they hear a lot more from you, and maybe they have some influence on directionally where this stuff goes, these things aren't going to enter the market space maybe as fast as they could. So, anyways, my goal with this video today was kind of give you an understanding of a couple different versions of stem cells. What are the version we're doing in practice, which is more from you, the patient? What are the things that are being studied, which are cell types or growth factors not from you, the patient? But all those are designed to stimulate a massive healing potential in the body, and just have countless success stories over my practice and my colleagues' practice of how effective these can work with very little risk profile to doing these type of treatments. So if that helped you in any way, click the like button. And if you want to see future content like this, hit subscribe so you know when we release new content. And if there's anything else on this topic or any topic inside of regenerative medicine or non-surgical orthopedics that I could do some future content on, just drop it in the comments below. And if I can help you personally in any way, click the link below. That will take you over to my practice website where you can fill out a few questions and somebody on my team would be happy to review your case and give you some direction on it, whether you're local here in Tucson or regionally in the Southwest, or hey, we can just give you some direction on what to do with the situation you're dealing with from a non-surgical standpoint. That's what I do here in my practice.